recently I was working with a patient who reached out after having one leg amputated. He was still in the hospital and wanted to know how to avoid a second leg amputation after the doctor notified him it was actually imminent. The weight of my heart had two doctors on standby, ready to review his records, but the hospital informed him it would be 2 weeks to process the request and release them as per standard protocols. And due to recovery from the first amputation, he just couldn't leave that hospital to get critical imagery elsewhere. Time was really of the essence. If the patient had immediate access to those records, he could have gotten a second opinion and possibly saved his second leg. But sepsis set in before he got his records and he lost his other leg. And ultimately, 1 month later, he lost his life. The records should belong to the patient. There is just no excuse for this man or any other patient to be at the mercy of a medical facility's red tape and not have control over their own health. I know I'm preaching to the choir here with Dr. Leah Houston, an emergency room physician and founder of HPEP, a company that's developing a new secure technology, which is going to give the power back to the physician, thank goodness, and ultimately the patient. Now, Leah, before we get into the technology itself, I want you to share that disheartening experience that you had that really led you to take patient healthcare back into your hands, that of the physician.
Well, there's been so many stories of frustrating friction moments in delivering patient care as a physician. I personally had my identity stolen. But I have to tell you, when I worked in the emergency department, there was many times when, a patient would want their records and I used to just print them out for them and hand them to them. And I was reprimanded several times by the administrators in the hospital saying, oh, no, you can't do that. You have to go through the regular protocols. I'm like, why? This is their information. It's wrong.
Oh, that's incredible. So, as you decided something should be done really about this problem, you must have written down a mission. What is that mission? Basically, what do you envision as the ultimate answer to this problem?
Well, if you think about it, in my opinion, the problem that we currently have has to do with the fact that the relationship between doctor and patient has now been digitized. What goes on in the medical relationship that you have with your doctor, it used to be just something that we documented as doctors just to make sure that we understood what was going on if we looked at your records 6 months from now, or if we needed to share your records with another provider or practitioner in order to make sure you get the best care. But these third-party EHR systems, these electronic health record systems, have essentially turned that documentation into a data capturing surveillance model for insurance companies and hospitals. And so in my opinion, and my mission, the mission of my company is to restore privacy, security, and trust to the doctor-patient relationship while still being able to digitally record what's been going on, but keeping that private and only between the doctor and the patient.
So reverse engineering that mission, what were the steps that you laid out to achieve that mission? I like to ask this so that people can understand the method to your madness in a sense.
Well, many of you guys are watching this on some kind of social media platform, be it LinkedIn or Facebook or Instagram. Each of those entities owns a little piece of your identity, if you think about it. Facebook might own a little more of your personal self or your family self. When you think about it, other online platforms like your banks own a little piece of your financial identity. In the future, our digital sense of selves will no longer be owned and controlled by these separate entities. They'll be owned and controlled by us. And there's a new secure technology called self-sovereign identity technology that will give you as an individual one password, one identity that's secure, that allows you to log into these systems, but now you are the owner and the control of all of the data that's generated, be it your banking information or your social media information or your protected health information as a patient. And many people don't realize as a doctor, we also have information, our credentials that allow us to prescribe and things of that nature. Those also should be owned by us rather than the hospitals that we work for. And that's what this is about.
So what specifically are you building with HPEP, your company? At its foundation, you mentioned it, a self-sovereign identity technology or SSI, but really mean in layman's terms?
In layman's terms, it means that when I log in to document something, the credentials that I use to log in will no longer be owned and controlled by some background technology that's owned by a hospital or an electronic health records company or a billing company. It'll be owned and controlled by me, and it does so by leveraging distributed ledger technology. Now, what we're doing is the foundational layer of this. The first layer of any change in a system is first bringing a community of people to change that system and to identify them. So we're building the first initial layer of the system, which is an identity and credential verification tool that's going to be handed to the individual practicing physician. So an individual doctor will own their digital credentials, their digital identity, and armed with that identity, they can go from health system to health system. And when they document information about their patients, they will own and control that information, and of course be able to give a copy directly to their patients if they also have a self-sovereign identity.
So how can patients actually help in driving this forward? I mean, all of them, even me, I mean, we want to get around the red tape of these hospitals and use something like this. Are hospitals actually aligning with this movement? Or is this going to be an uphill battle that we're going to have to create a groundswell of patients and physicians to move this forward?
Well, I think it's really important to look at the regulations and to look at the laws. I encourage everyone here to look up the 21st Century Cures Act, specifically items 4003 and 4004. And they are governing rules around interoperability and information blocking. And they basically say that it's now time for all health systems and electronic records companies and hospitals and doctors' offices to give you as a patient easy access to all of your protected health information. Now, there's probably a spectrum of people who are trying to achieve this, but if you look at it, they really fall into two camps. They fall into the camp of people who really would prefer to keep things the way that they are, where they get to deploy surveillance capitalism, data capturing models in order to control physician behavior and to control patient behavior. Or there's new systems like the ones that we're trying to build with HPEP, and like companies that like HIE of One, who's building a self-sovereign health record platform for patients that are really trying to put ownership and control into the hands of the individual and you know, make the patient sovereign, you know, over their health records and over their information. And so understand the regulations. You know, in most states, physician owns the health records that they generate according to Fourth Amendment property rights. We wrote those records, we created them, and therefore we do own them, except for in the state of New Hampshire. But, you know, most physicians are totally fine with sharing those records with their individual patients. It's the regulations and the rules of the places in which they are employed and the insurance networks that they're a part of that don't allow them to make that easy. So pay attention to that rule, the 21st Century Cures Act, and start demanding that they follow it.
Yeah, that would be incredible. I mean, we really have to, the patient I mentioned in the beginning of our conversation should not have to wait 2 weeks through hospital red tape to get his records. He should have those instantly. It should be his right as a patient to have instant access to every one of his images and every bit of the case notes that a doctor writes.
Absolutely. Absolutely.
And what do the payers think about this?
Listen, you know, a lot of people say, oh, what about the hospitals? Are they on board? What about the payers? Are they on board? In my opinion, they're not payers. They're deniers. They deny payment to doctors. They're increasing the number of prior authorizations that we have to fill out just to get our patients care. You know, they're sending you as patients surprise bills. This shouldn't be a surprise. This is a covered service under your insurance, and they should be paying for that service. Just because they decide that my services aren't what they, you know, aren't worth what I charge, doesn't mean that they aren't obligated to pay. And so it's really on the patients to start demanding payment for the services that are rendered, or else doctors are going to start refusing to take insurance more and more. And, you know, there's not a doctor I know who doesn't want to do the right thing for patients, but we need to be paid for our services, and these insurance companies are denying it. So long story short, I don't really care what they think. You know, I don't need an insurance company to do my job. I don't need a hospital to do my job. I know how to take care of patients. I just need a patient in the room and perhaps some tests or some tools to perform whatever procedures I might need to do. I don't need to be dictated by an insurance company how to do my job.
So where are you at in this journey in making this something that is viable and expandable?
So we are in the middle of developing our MVP, which is a minimal viable product, which is just a basic version. You know, this technology is very revolutionary, but it is very new still. And so it's just going to be a basic credentialing and identity wallet for doctors. But then that is, you know, the platform upon which everything else will be built. And so that's where we're at. It probably will take another 1.5 years to develop the full model. And by then, I'm hoping that there's other self-sovereign identity tools. And the reason that I really want other people to also build solutions is because if these tools are built on self-sovereign identity standards, which are the technological standards behind which, you know, the actual technology is built, then they'll be interoperable. They'll be able to communicate with each other, but it'll be more private and secure at the same time, which are both, you know, currently difficult to achieve in the current ecosystem.
Well, thank you so much. I really appreciate you being here, Dr. Leah Houston, emergency room physician and founder of HPEP, and you can find out more at hpep.io. Thank you so much, Leah, for literally putting the power back in the hands of the physician, ultimately the patient.
Awesome. Thank you so much for letting me share what we're working on. I appreciate it.